I recognize the gentlelady from Virginia for her 5 minutes of questioning.
Thank you, Chairman Griffith, and to Ranking Member DeGette for holding this timely hearing. As we've already talked about, across the country, millions of Americans are facing soaring healthcare premiums and higher out-of-pocket costs as the new year is beginning. And today, approximately 22 million Americans who rely on the Affordable Care Act marketplace coverage have lost their enhanced premium tax credits that kept that coverage affordable due to the Republicans' refusal to act before now. In Virginia, this includes small business owners, their employees, the self-employed, farmers, retailers, restaurateurs, people like my constituent Bobby Connor from rural Brunswick County, who was 3 years away from Medicare. Last year, he paid $34 a month for his premium. This year, with the tax credit, it would have gone to $92 a month. Without the tax credit, he's facing a premium that is $1,700 a month. Lester and Yolanda Johnson and their 3-year-old daughter, owners of the Mama J's restaurant in Richmond, have gone from paying $700 a month for their family of 3 to now $1,400 a month. And this comes at the height of an affordability crisis in the United States as groceries, gas, rent, and now healthcare costs are rising, squeezing families' budgets and prompting impossible choices between coverage and basic necessities. More than half of American families lack the resources to live securely in their communities, with grocery prices up 32% since 2019, and the lowest price ACA Marketplace Silver Plan up 41%. This affordability crisis isn't limited to working-age Americans. Seniors enrolled in Medicare Advantage, which now covers more than half of all Medicare beneficiaries, are also navigating rising costs and making difficult choices to afford prescriptions and provider visits. I'm glad the committee is considering my H.R. 5243, which would require companies that offer Medicare Advantage plans to submit enrollee-level data on supplemental benefits to the Department of Health and Human Services, thereby increasing transparency around Medicare Advantage supplemental benefits and helping seniors make better informed decisions amid this ongoing affordability crisis. So with that, Mr. Lipschitz, from your work with Medicare beneficiaries, how often do seniors choose Medicare Advantage plans because of promised supplemental benefits like dental, vision, or transportation that they've seen advertised on television, only to later find out that those benefits are difficult to access or far more limited than advertised?
In our experience, quite often, supplemental benefits really drive a lot of decision-making when it comes to plan enrollment, but people don't realize that these supplemental benefits are not standardized and they vary considerably by plan, and they can change from year to year. So as you note, advertisements are full of articulating the supplemental benefits as a means to draw people in. But oftentimes when people get in the plans, they find that they have more difficulty than they anticipated trying to access those benefits.
And sticking with you, if Medicare Advantage is going to continue to grow as a major part of Medicare, what role should transparency and accountability around supplemental benefits play in ensuring the program truly serves seniors and not just insurers?
I think transparency and accountability are paramount when we look at the program. These are public dollars going to private plans to administer benefits for the Medicare population. We need a lot more accountability and transparency. This is a start, so thank you for introducing this.
I agree, thank you. And would requiring carriers to report enrollee-level data on supplemental benefits to the Department of Health and Human Services better align advertised benefits with what seniors actually need and leading to greater participation, more meaningful coverage, and better health outcomes for beneficiaries?
Agreed.
Thank you. And with that, I will yield back.
Gentlelady yields